I first wanted to ask if you could tell me a little bit of the type of therapy you offer, because honestly, I'm just learning that there's many multiple different kind of variations.
Yeah, there's multiple kinds of therapy and therapeutic work. So I'm a certified Canadian counselor. So I have a master's in counseling psychology. So I offer counseling, and I'm also a somatic experiencing practitioner, which is a type of um, trauma work that works specifically with the autonomic nervous system. And so that's my combination is a counselor and a SEP. And I'm in private practice and work with adults. Yeah.
Okay, great. Thank you so much for explaining. Um, so yeah, I guess this is a little bit of a big question to start with, but have you seen the pandemic affect mental health resources and I guess the availability of mental health resources in Montreal?
hmm Yeah, I would say that from what I know, speaking with colleagues and speaking with other practitioners and other therapists and counselors and folks in the mental health field, is that there's an incredible demand for mental health support. It's gotten very packed, right? Long wait lists and full rosters of clients, and practitioners themselves are spread pretty thin. So I would say what I've known since we're coming up on 1 year of being in variations of lockdown, and since the pandemic started officially, there's been a really high demand for mental health support. um, yeah, whether that's individual, whether that's couples, whether that's family, whether that's group. I've just across the board have seen a demand for work. Yeah.
Are you having to turn away clients just because there's such a large, I guess, increase in people coming to you for services?
Yeah, I'm having to turn people away. I know many colleagues that are having to turn people away. The best that we can do is keep inquiring where there are spots available and referring people there, directing people to places and spaces where there's availability, in the hopes that they'll find somebody more immediate. Because even waiting lists are up to 6 months or 4 months, and um, even longer. So yeah, I would say that definitely having to turn people away, and trying my best to just direct folks to resources that are still taking folks, so that they have someone. Yeah.
Okay, thank you. Would you say that maybe this is more a question of public mental health care in Montreal,
hmm
but would you say that you maybe notice some flaws within this system and maybe would like to comment on how it could be improved?
There's a lot to say about that. I think for me, two things come up. One is the way that our social system makes it sometimes challenging and difficult to receive competent care through the formal therapy and therapeutic avenues. So, through your CLSC, being put on sometimes long wait lists to have access to a nurse that can do an evaluation to then find out if you can receive psychiatric help, or work with the psychologist, or to work with the practitioner. That in itself is, it just comes with the territory of trying to find free government funded support, which I don't necessarily think is there's anything wrong with that inherently. But the thing that I do want to comment on is that there's so many, as we were saying before, there's so many different kinds of therapy, and there's so many different types of mental health support. And what can get challenging is that if you don't fit in that particular strain or avenue of mental health support, like being a psychologist or a psychiatrist or a social worker, then you're going into the field of private practice and you're going into this massive web of practitioners where people have to sort of individually try to find support, and there isn't really social infrastructure to help you find practitioners that you might resonate with or whose approach might make more sense to you because it's not governmentally approved or under or valued. And so that can get really, like, for example, with somatic experiencing work, um, it's starting to get more and more recognized, but it's not something that, let's say, I could find a government job through to sort of plug myself in as a social servant, right? To be able to help folks through the system. So there's that piece which I think is difficult. And then there's another piece just around like informal mental health, right? So space, like, Emmy Quebec is a great resource to try to find, for example, right now they're offering a variety of Zoom group support, right? But I really wish there was more places and spaces where people could go to get group therapy, group support. And maybe it's not even quote unquote therapy. Maybe it's just places that are intrinsically therapeutic because they promote connection, they promote authenticity, they promote affirmation. You're allowed to show up and be seen and heard. There's a big realm of therapeutic places and spaces that could be governmentally supported and funded, um, that I don't see available. Maybe they exist, I could be wrong, but I don't often come across those. And so again, it falls into private practice and people are expected to, go to websites like meetup.com to try to connect with people and make interpersonal connections. It would just be wonderful if those kinds of things were governmentally organized and funded. Um, yeah.
What do you think that it might take to get these different types of therapies government funded, like maybe like a social movement or just, I guess, more awareness put towards it?
Yeah, I would say definitely more awareness. Sometimes the catch 22 is that in order for these types of therapeutic practices to be governmentally supported, they need to have evidence based, very quantitative research based proof. And that takes so much time to build. And that also takes money. And so it's a bit of a cycle of, okay, who's investing in research to demonstrate that this particular kind of modality is effective, and then that research has to come out, and then there needs to be leeway and push to incorporate it on a governmental or on a social level. So that can be a tremendous amount of work, right? Versus if the practice in itself is effective but it doesn't have quantitative research based evidence, it has more of a qualitative value. You're helping people but they're not in a participation, like something like CBT gets very well recognized in comparison to more qualitative work that maybe takes longer or is more nuanced or more complex, not as quantifiable. So I think that, yeah, there has to be a shift to like how we demonstrate the effectiveness of different types of therapy and different types of treatments. There needs to be a shift in that. And there also needs to be absolutely like a movement. I don't even know what that would look like, right? Because as practitioners, we're spread so thin, like even just the idea of doing a platform to try to push for, let's say, authentic relating work or somatic practice being governmentally supported, like that would be a full-time job that I would have to undertake, or that a practitioner might have to undertake in order to get that funded. So it's kind of difficult to build momentum on that front.
Okay, it seems, I guess,
Yeah,
maybe like a long journey,
I
unfortunately.
think it's a long journey. Yeah, and hopefully people will. people that have extra energy can make movement and leeway in that direction.
Um, do you think in terms of I guess because of the pandemic, have you seen the narrative towards mental health and therapy alter and maybe kind of be put a little bit closer to the importance of physical health?
Yeah, I would definitely say there's a shift. Um, just in people having to spend a lot more time alone and to be with their own thoughts, to be with their own mind, to be with their own mind body phenomenon, and recognizing, okay, there's some stuff here, right? There's some stuff that maybe someone has been avoiding for a very long time, or they've been busy with work and they have noticed, or maybe there's hidden grief of things that they didn't face from many years ago. So stuff is bubbling to the surface, is what I've noticed. And in a way, it's a profound invitation, right, to do the deeper work. If there's enough resourcing, if there's enough support, it's actually a profound invitation to do the deeper work that maybe because of the hustle bustle of our lives, because of the culture and the systems we live in, we might have run away from for a very long time. And yet there's this lull in the busyness where we're confronted. Some of us are confronted, many of us might be confronted actually with what lies inside, what kinds of thoughts we actually have about ourselves, what kinds of fears we have. And again, with the right conditions and with the right support, that can be pretty profound work to be done. Yeah.
Absolutely. I definitely
Yeah.
connect to all of that.
Yeah.
No, it's interesting seeing, especially in the conversations I've been having with friends just over the course of the pandemic, just how much I guess we've been connecting and like speaking about our childhood in a way that I don't think we have ever really like, at least overtly
Mm.
kind of thought about or tried to identify. So yeah, the
Mhm.
pandemic has been good and also kind of bad for that, but no, it's definitely important to kind of disconnect from our regular lives and identify these things.
Yeah, and to know that we don't have to do it alone. It might be really difficult to find the right support, but in a way, just giving ourselves full permission to find as many opportunities of support, whether that's group, whether that's online, whether that's in person, whether that's body work, whether that's mind work, mental work, spiritual work, right? Like connecting with, all different modalities of healing and helping, treatment, therapy, so that, that work doesn't feel overwhelming. Because if you're noticing stuff come up and you don't have resourcing, then I think what the other kind of the shadow side that I've seen and that I've, heard folks vocalize is just a lot of numbing, right? And a lot of just keeping your head down and trying to make it through. And that's not the same as an invitation to work on the deeper thing. That's survival mode. Now it's like this stuff that's coming up is way too painful. I can't do it alone. And so I'm going to really numb myself to get through. And, I feel a tremendous amount of compassion for folks who are dealing with, you know, trauma and grief and pain that they unexpectedly have to confront, and on top of that they feel like they need to do it by themselves. It's too much. It's too tall of an order for anyone. So yeah.
Absolutely.
Yeah.
I've been thinking about burnout recently. I think I actually thought of it because when I was doing research on this topic, it came up that there was some people were trying to get burnout, I guess, classified as a mental illness. And are you maybe seeing more burnout, especially in terms of essential workers or just people who have to be in front of the computer 24/7?
Yeah, I would say that burnout is something that's looming in the the environment, right? It's looming in the atmosphere, and frontline workers, people that are working throughout the entire pandemic that, do not have either the financial um, stability or the security, or they just can't afford to take time off, or they're needed through this time. Um, Absolutely, there's burnout in the air, and one of the things that manifests as is compassion fatigue, right? It manifests as a depletion in, curiosity, a depletion in presencing, a depletion in being able to show up, right? And it can manifest as agitation, irritation, the body shutting down, like quite literally sickness, physical sickness. So there's this question, right, which is like, how are we filling our cup while we're doing the best of our ability to give what we have, right? So if you think about just even compassion as a thing that's received and distributed, if we're giving, let's say, as emotional workers, as mental health workers, if we're giving a lot of compassion out, where are we getting it from so that we can give it? Because we can't give what we don't have, right? And when we are overextending, which is I think what's happening to a lot of folks right now, we're overextending, we're trying our best to give what we know is needed, but doesn't mean that our own cup is being filled. But we might be giving what we don't have, and we might be going into our reserves and into our savings, right? If you want to think about it in that way as a metaphor, like you're going into your savings account, you're going into your reserve account, and that has an impact, that has long-term impacts. There's research that shows that even recovery from burnout can be like a minimum of 8 months to a year, right? So it's not like it's a thing where you go on vacation for 2 weeks and you're fine. It's like just on a physiological level, your cortisol levels, adrenaline, adrenal fatigue, like your body, just on a purely bodily level, the time it takes to recalibrate and to come back to homeostasis can take many, many months, let alone the mental and emotional toll of burnout and of, um, you know, not being able to do the work that, a person might find really meaningful. It's like that can be and feel really devastating. Yeah.
How do you kind of recharge or, make sure that you're not reaching burnout?
Yeah, yeah. Really, truly, it's like relentless self-care. It's just not seeing it as a negotiable. And what that looks like is going to be different for each person. But just inviting my colleagues, inviting myself to be very curious about what restores me, what regenerates me. So that could be anything from art, and that could be, drawing, dancing, singing, whatever it is physically, whatever it is emotionally that provides nourishment. It could be just focusing and prioritizing cooking really good food, right? Making sure that just on a physical level, I'm taking vitamins, I'm taking supplements, I'm drinking enough water, I'm eating really well. That could mean connecting with friends and loved ones, and not just connecting over how things are difficult, but intentionally making quality time. So laughter, prioritizing and focusing joy, being curious about each other's resilience, playing games, right? And connection to nature is huge, right? Like knowing that the earth is supporting us throughout all of this. We have the sun supporting us. We have, the air supporting us. These are all things that literally keep us alive, connecting to them, right? Connecting to things bigger than ourselves. I remember when the pandemic first started and I was listening to the birds chirping and seeing the birds eating, bird seed and playing with one another. I'm like, yeah, nature is continuing on, right? There's still things bigger than us happening. Because I think right now, our lives can get put under a microscope and they can feel very microscopic. And so taking a step back and recognizing, the sun is still rising and setting, the birds are still chirping, the earth is still moving. And yeah, but those have been my things, is like nature, art, poetry, singing, dancing, exercise, eating really good food, laughter with friends and loved ones. Um, that's been keeping me replenished. Yeah.
Thank you for sharing. Um,
Yeah.
how would you say that the pandemic affects the mental health of individuals, not just now, but maybe in the long term?
Hmm. Yeah. I've been thinking about that actually, and reflecting on how challenging it might be to establish relationships after the pandemic, right? Like we've become, many of us have become very accustomed to spending long times by ourselves. And so there's a curiosity I have of how are we going to support one another to reconnect, to reestablish relationships, to slowly, learn to, even just something like holding hands or being close to somebody or physically connecting to somebody. And I'm definitely concerned about there being an extreme pendulation from extreme isolation to like really trying to get our needs met in this fast, overwhelming kind of way. Like when we're allowed, well, like what's going to happen, and I've heard people get concerned about that, like what's going to happen when we are allowed to like connect. And it's like, are people just going to just go wild and and it's like, yeah, that might happen. And I think we need to start thinking and talking about that, about how can we titrate, right? How can we slowly move in the direction of closeness and intimacy? um, because I think that's a big factor in mental health, is relationships. Do we have loving, stable, secure relationships throughout all of this? And if we don't, how do we start to make movement in that direction, even despite the obstacles in our way? So that's a big concern that I feel. And um, yeah, that's probably the main one that occupies me the most as a practitioner, is relationships and how people are going to reestablish them after. Yeah.
That's good to think about. I guess I haven't given that too much thought, but it's an important thing to think about. Yeah.
Yeah. Yeah. If there's one piece I can add about that, it's really trying to challenge the abstinence approach that we take to things, right? Like I think about even sex education growing up, and I don't know what it's like now, but like in the 90s and 2000s, it was like, just don't do it. And if you do it, it's very shameful and shame on you. And so people just pendulate from like, don't do it, don't do it, don't do it, to if I do it, I don't have any education on how to do it in a harm reduction way, in a safer way, in a more consensual way. And so there's this pendulation. And I kind of felt that same vibe with the government's response, and the way that socially we're responding, which is like, just don't connect, just be by yourself, and to the best of your ability, don't connect. And what we're seeing is like people are connecting secretly, they're connecting in this shameful way, they're feeling ashamed, and it's also just not safer, right? Because then nobody's educating us on how to have harm reduction conversations, safer, more COVID friendly, more COVID safe conversations. If those could be available and we could practice them, then maybe we could have more of a harm reduction approach, which is more my stance, as a harm reduction approach rather than a abstinence approach. Because even research shows abstinence approaches are ineffective, right? People just end up lying and shamefully doing the thing anyways, with way less safety measures in place, right? So that's something I'm concerned about. And I think people need to take into consideration, is like, okay, if you're going to let's say, break the rules, like there should be spaces and places available to practice. Okay, what does like a COVID check-in look like and sound like? Right?
For those who, you know, are really in need, especially in immediate need of mental health support, and they're facing these 6-month wait lists. What do you recommend that they can do? What kind of support can they seek?
Yeah, I would recommend um, trying to join groups, trying to join online support. So there's an emerging online therapy platforms, right? There's kind of an emerging field of online therapeutic work. And so if that's something that appeals to people, give it a try, right? Just giving yourself permission to be curious and to see if it lands, to see if it feels effective. And if it doesn't, then you try something else. But that's sort of the stance I encourage people to take right now, is just be experimental. We've never been here before. We don't know what to do. We don't have a blueprint on how to navigate this in the perfect way. That doesn't exist, right? So in replace of that, just inviting folks to be really curious and experimental, try different things, try online, try chats, try group, try maybe not necessarily explicit therapy if if you can't find that, but to even just again see if there's a group that meets outside and goes for hikes, if there's a group that is COVID friendly that goes outside and does skating, or um, online group Zoom conferences that are around things that light you up and that are juicy for you, that are interesting for you, right? Like these are all therapeutic, even if they're not quote unquote therapy, right? And so I try to really take like my kind of Eastern background, which is like therapy is having like extended family, right? Therapy is having cultural, members, and like, teachers, and whatever, like different extended people in your community, right? So, and if you don't have that and you want to make that, see if you can make that. See if there's people interested in your community that are, down at a book club, for example, and you read a book together and you discuss it once a week. Or maybe start a group or a gathering once a week of something that you're interested in, and see if other people, maybe total strangers that you end up becoming friends with, that are interested in the same thing that you want to geek about during the pandemic. um, but yeah, just to like, it not doesn't have to just be formal therapy. It can also be therapeutic things and practices. Maybe there's people that you work over Zoom, or as the weather gets nicer, you find a jogging buddy, or you find someone that you can do yoga with in the park. But um, it's a constellation, right? It's not just one thing. Even the best therapist isn't enough, right? Whole human beings with many sides, with many um, complex dimensions, right? And not just one professional is going to be able to fulfill.
Thank you for sharing. I also wanted to ask, do you find that the lack of availability and affordability of mental health services, do you find that it's affecting specific groups such as BIPOC groups or lower income groups?
Yeah, I wouldn't know um, factually, in the sense like there isn't any research that's um, specifically about the pandemic and accessibility, at least that I have come across. But that yes, people that are already working class, people that are already poor, people who already struggle with finding relatable therapeutic services are going to have a more difficult time. There's been some really beautiful resources that have come up. There's two um, resources that have come up specifically for BIPOC individuals to try to find BIPOC counselors and therapists and practitioners. One is the Lavender Collective, which is just this great resource list that came up. And then the other, I just want to find the exact name to make sure I say it right. The other is called the Black Healing Fund. And both of those are resource lists that folks can you could do a quick Google search and find, and there's a whole list of practitioners on that specifically for racialized people. P10 Project 10 is a great place for queer and trans resources. So just there's a lot online, but yeah, absolutely. I think that financially, of course, if you're already struggling, then you have to take into account putting money aside for that, which can be really challenging or just not even accessible at all. And then you might have to go through a government funded program, which, we can hope for the best that you find a competent practitioner who can work with you. Yeah.
Thank you. I'll try to finish up. I know I've taken so much of your time, and I
No,
really
it's
appreciate
fine.
it.
Yeah.
I know that I just thought of this when you were mentioning a government support. So I know someone who I forget what it's called, but they essentially had 3 free sessions funded by the government. And I was kind of thinking about the difficulty of starting, with one therapist and then, having to find someone else. Is there anything that you would like to say on just kind of the challenges of maybe starting over or trying to find someone for the long term?
Yeah, it's unfortunate that the government funded therapies are often short term. They're brief. It's like get you back up on your feet, and um, yeah, I don't really know what to say other than it's very hard, and to give yourself time, just to encourage people to give themselves time to adjust and readjust. And also I would say, like, there's actually a tremendous amount of power in being the client, to ask questions, to be inquisitive about worked, what didn't work for you, what you want, what you don't want, what resonates, what doesn't resonate. It's like we were saying at the beginning, there's so many modalities of therapy. And the way that I like to see it is it's like the kind of glasses that you're wearing, right? It like filters the way you perceive a struggle. It's the way you perceive or interpret or make sense of a particular human condition. So if that lens doesn't resonate for you, then it's like you and another person are looking at your issue with two totally different perspectives. So finding practitioners whose perspective matches yours, right? Do you see it as a spiritual struggle? Do you see it as a cultural struggle? Do you see it as a psychoanalytic family childhood struggle? Do you see it as a physiological chemical struggle? How do you make sense of your own issue, and then trying your best to find somebody whose perspective matches that, so that you can collaborate together? um, but yeah, I don't know if that quite answers like the 3 sessions thing. I think like that's it sucks. Like I don't know what else to say about that other than like it's hard. And yeah.
Suck. No,
Yeah.
that's a great answer. Thank you for sharing that. Is there anything that I didn't ask that you think is important to know, or maybe just recommendations or of what you think is important for me to consider when putting this story together?
Mm, There's people are doing their best, and we don't always show up as our best when we're spread so thin, right? So just like, and try to invite myself and everyone to take a step back and recognize that this is just uncharted territory, and we might be really tested in our character, in our patience with one another. We might be showing up in very we might be showing up with a sense of scarcity, and that's going to impact how we show up, versus when we're showing up with a deep sense of abundance, we might be way more generous, way more patient, way more compassionate. So if you find like you're short with the people in your life, it's like I do think the challenge right now is how do we fill up our cups individually, collectively, so that we can show up in loving ways for one another. Um, because I think that's a challenge, and like a lot of stuff is bubbling up for people, and how to let that stuff come up, but doesn't mean you have to take it out on your neighbor or take it out on your roommate or take it out on your partner, right? Like there's, I think, some evidence of lateral violence happening, especially in communities where there's already scarcity, and just to be mindful of that, that it doesn't represent who we are infinitely, or it doesn't represent who we are in the long term, but that we might not be showing up as our best selves these days. And um, yeah, to be forgiving about that.